In today's episode of Color Me Flared, we are going to discuss the profession of a nurse anesthesiologist, which is one of the top 10 highest paid careers.
Who is nurse anesthesiologist? One of the most important members of the healthcare team is a nurse anesthetist to give patients safe, pleasant treatment. Advanced practice nurses who are nurse anesthesiologists, also known as nurse anesthetists, administer anesthesia during a range of operations. The precise duties that a CRNA is expected to carry out can vary based on the job, organization, and care setting in which they operate. They may also provide associated care before and after these procedures. Despite having distinct educational backgrounds, nurse anesthetists and physician anesthetists anesthesiologists use the same techniques to provide anesthesia. According to studies, the outcomes of treatments given by nurse anesthetists and physician anesthetists are equally safe, high quality, and effective. A job as a nurse anesthetist is tremendously satisfying in terms of both personal and professional fulfillment. By enrolling in math, science, and health courses like biology, chemistry, algebra, geometry, psychology, health vocations, or foods and nutrition, high school students can get ready for a future as a nurse anesthetist. What do they study? APN's Advanced Practice Registered Nurses are nurse anesthetists APRN. They have advanced degrees and have studied for an average of 6 to 8 years in higher education. Their typical educational path entails getting an associate's degree ADN or a bachelor's degree BSN in nursing, passing the National Council Licensure Exam NCLE-XRN, and becoming a licensed registered nurse RN, getting an APRN by finishing advanced training. The usual prerequisite for this is having worked as an RN for at least a year. Currently, the majority of APRNs get an MSN, or Master of Science in Nursing. However, by 2025, all new nurse anesthetists will need to hold a doctoral degree. You will need to complete around 2,500 clinical hours and administer anesthesia in a clinical environment under supervision at least 600 times while pursuing your advanced degree. Process for certification. The National Board of Certification and Recertification for Nurse Anesthetists requires you to pass a national certification exam after completing your advanced degree program NBCRNA. Every 2 years, you must recertify to keep your license active. To do so, you must complete 40 hours of continuing education requirements and verify your anesthetics-related employment. If you want to work as a CRNA in the United States, for example, you must finish the following requirements: get your bachelor's in nursing or a related career, obtain a U.S. acceptable license for registered nursing, complete a minimum of 1 year of critical care nursing practice. The average RN entering a nurse anesthesia school has 2.9 years of experience in this field of nursing, per the AANA, in a course of study accredited by the Council on Accreditation of Nurse Anesthesia Educational Programs. Get a graduate degree in nurse anesthesia. Complete the national certification exam. The next step for someone who already holds a bachelor's degree in nursing or a closely related discipline is to enroll in a graduate level program. Currently, a master's degree from a nurse anesthesiology training program is the minimal need for certification as a nurse anesthetist. Nevertheless, this criterion is evolving. You will have the chance to learn more about anesthesiology in depth and hone important leadership abilities in a PhD program. A doctor of nursing practice emphasizes the clinical side of the field and often involves a practicum or other hands-on component, in contrast to a nursing school, which has more of an emphasis on research. After completing the nurse anesthetist program, you'll be prepared to create a synopsis of the most recent theories in nursing, such as organizational, physiologic, and safety theories, to improve nurse anesthesia practice and increase patient safety, to enhance the quality of patient care and nurse anesthesia practice, analyze pertinent and scientific literature, and implement findings in a culturally sensitive manner. Lead others in overcoming the difficulties posed by the sophisticated healthcare and educational systems of today through accurate and effective publications, leadership roles, presentations, and cooperation with other disciplines. Demonstrate scholarship in the field of nursing anesthesia. Demonstrate high levels of clinical responsibility and discretion in the field of peri-anesthetic care. What do they do exactly to prevent you from experiencing pain or anxiety during a medical operation? Nurse anesthetists use a drug called anesthesia. The nature and duration of the procedure as well as your demands, will determine the anesthesia. You are kept sleeping during surgery by general anesthesia so that you are completely unconscious, while some of the medications are administered by IV. Others are inhaled using a tube or mask, a small needle inserted into a vein that delivers liquids to your body through a tube. During a procedure, you won't be able to feel anything in that area of the body due to regional anesthetic. A catheter, which is a thin, flexible tube that is inserted into a vein to supply anesthetic medication throughout the procedure, may also be used instead of a single shot. Anesthesia, known as sedation, is frequently administered by IV. You become relaxed and sleepy under mild sedation, which helps you feel less nervous before a procedure or exam. You are helped to nod off by a mild sedative, but you can readily wake up if necessary. You fall asleep under deep sedation, losing consciousness throughout the process. Your nurse anesthetist will inform you about the sort of anesthetic they intend to employ before a procedure, as well as its dangers and potential adverse effects. They could conduct a physical examination and inquire about your past health. Which universities or institutes offer this program? List of top Turkish universities with Bachelor of Nursing Anesthesia programs: BHCS University, BIRUNI University, HLIC University, Istanbul MAPOL University, ISDINY University. Some charge fees between $5,000 and $10,000. The typical nursing tuition is $5,520. In contrast, the cost of tuition for undergraduate nursing programs in the U.S. is between USD $40,000 and $80,000. How much do they earn? Some of the highest paid nurses are nurse anesthetists, with a median annual pay of $195,610. In Istanbul, Turkey, the average salary for a registered nurse is $141,000 per year and $68 per hour. A registered nurse may expect to make between $98,282 and $171,606. The highest level of education often required for becoming a registered nurse is a bachelor's degree. To find out more about different universities and institutions around the world, which career path to choose, and how entrepreneurs are doing in the field you want to enter, click to the subscribe button below and turn on that notification bell to get notified as soon as Color Me Flared uploads something new and exciting for you.